new day, a new high. There is simply no stopping the second wave of COVID-19 in the country. The fresh numbers tell us that we have over 261,500 cases reported in the past 24 hours. Deaths, that's the big news at this hour, 1,500. This is the highest ever since the onset of the pandemic. So Kirti joining us live now. So Kirti, so far we've been talking about numbers. We kept saying the virus is spreading faster, but perhaps not as lethal. But the present number making us question that as well.
Well, the numbers at this point, the situation on the ground reaching horrifying levels at this point of time, and the numbers, just to make sense of it in terms of how they've increased in the last 1 week. If you look at the total COVID cases, it has gone from 1.6 lakh to 2.6 lakh. So that increase, that big jump of 1 lakh in the COVID numbers has happened only in the last 7 days. From 12th April to 18th April, we've gone from 1.6 lakh cases every day to 2.6 lakh cases. If we look at the deaths, just until 7 days ago, there were about 900 deaths that were happening. Now we are reporting 1,500 deaths on a daily basis. So both in terms of our COVID cases as well as in terms of the daily deaths that we are reporting, the situation very concerning at this point of time. If you look at the top 5 states today that have reported highest numbers, at least 3 of them have reported over 20,000 cases. Maharashtra is 67,000 cases, UP 27,000, Delhi 24,000, Karnataka and Chhattisgarh with 17 and 16,000 respectively. If you look at the COVID deaths, Maharashtra has reported over 400 deaths. The others being Delhi, Chhattisgarh, UP, Gujarat, at least 3 of them have reported over 100 deaths in the last 24 hours. So the situation across major states in India is a big worry at this point of time. And as my colleague Purva was pointing out earlier, it is a tragedy that even at this crucial point of time, there is still politics going on with chief ministers claiming that the prime minister is not available to take their calls about the medical resources that are immediately needed. So on one hand, we have the rallies, on the other hand, we have politics being played between the center and the state. Yet on the ground, common man struggling to even get a single hospital bed for his or her family member.